This meeting is being recorded.
Hello everyone, a very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Excellence and Research Team at QurHealth. I welcome you all for a thought-provoking webinar on managing hypertension and its complications. Our guest speakers for today are Dr. Sujatha and Dr. Sudeep. Before I start the webinar, let me give you all a brief introduction about our company. At QurHealth, our vision is to save lives super proactively. We have developed QureBook app with more than 1,500 care plans and diet plans under 30 different health categories. These plans help you to monitor your vitals, symptoms, and everyday lifestyle management activities, which are specific to your health condition. We also have Sheila feature in the app. She is an AI-based healthcare assistant, and she will record your vitals, symptoms, and also activities. She'll be able to answer to the questions that you ask her related to the health condition. Under Cure One Care Concierge program, we have highly trained and experienced nurses who act as care coordinators. They'll be remotely monitoring your health condition through regular follow-up calls, and they'll make sure that you adhere to your care plan activities. You'll take medication on time and also eat your healthy food, which is listed in your diet plan. So before we begin, I would like to inform all the viewers that you can type your questions in the comment section, and these questions will be answered by doctors at the end of the webinar during the Q&A session. This will be conducted by Dr. Isha. I would like to introduce our speakers for today. Let me start with Dr. Sudeep. Dr. Sudeep has graduated from the University of Mysore, and then he moved to UK to pursue his higher studies. He has trained and worked in the UK for 12 years, gaining his super specialist degree in diabetes and endocrinology. His day-to-day practice involves treating patients with diabetes, thyroid conditions, and several other hormone-related problems. His special interests include managing people with thyroid disorders and use of technology in managing diabetes. Welcome, Dr. Sudeep, and thanks for joining us today.
Thank you, ma'am.
We have Dr. Sujatha. She has graduated from Sri Devraj Aras Medical College. She pursued her MD in anatomy from MRCP, Gulbarga. She pursued her fellowship in diabetes from Apollo Medversity. She did her master's in family medicine from CMC Vellore and has completed her fellowship in family medicine from St. John's Medical College. She is presently associate professor at PS Institute of Medical Sciences and Research. Previously, she was assistant professor at Akash Institute of Medical Sciences and Research Institute. Welcome, Dr. Sujatha, and thanks for joining today's session.
Thank you, Dr. Jamuna.
Okay, so viewers, let's begin our today's webinar. Hypertension is a major cause of premature death worldwide. Hypertension is also called as a silent killer. An estimated 46% of adults with hypertension are unaware that they have this condition. World Hypertension Day is globally celebrated each year on May 17th. This is to bring awareness and promote hypertension prevention, detection, and control. The theme of World Hypertension Day for 2022 is measure your blood pressure accurately, control it, live longer. Today, we will be discussing on hypertension-related complications and what are the preventive measures to be taken. Let's begin with Dr. Sudeep. Dr. Sudeep, can you please brief our audience about hypertension and also what are the blood pressure values that indicate different stages of hypertension?
Hello, everybody. I thank you for inviting me to speak in the forum today, and I hope it would be a good informative session to all of those attending. Hypertension in common man's words is high blood pressure, or BP in what most of my patients locally call it. Blood is carried around in tubes of vessels in our body, and blood carries oxygen and various nutrients to the different parts. and to facilitate movement of blood around, the heart pumps. When we say blood pressure, it's the pressure within these blood vessels when the heart pumps and relaxes. Blood pressure, actually, when we measure it, has two readings. The top reading is called systolic blood pressure, or the pressure in the blood vessels when the heart contracts or when the heart beats. And the bottom reading is the pressure again in the vessels when the heart relaxes. Blood pressure is different for different age groups, especially in children and adults. Once you are an adult, everyone needs to have a normal blood pressure, which most of us might have heard of as less than 120 by 80. Which is 120 being the top reading and the bottom reading being 80. If the blood pressure is more than this, it's then considered to be abnormal. We have about a definition of 4 different stages of hypertension, mainly for the doctors to understand and explain to an individual of how high the blood pressure is, and also it will tell us how serious we have to take it and what strength of medications to choose. Then the blood pressure is more than 120 systolic, but less than 130, and the bottom reading less than 80, which is slightly more than what a usual person's blood pressure is. We call it as early or pre-hypertension. This is not significantly abnormal, but at this blood pressure also people could have increased risk of getting problems and also blood pressure worsening. So this is like the borderline blood pressure area. After that, we have something called as the stage 1 hypertension, where blood pressure is more than 130 systolic, the top reading, and less than 140. The top reading is less between 130 to 140. The bottom reading is between 80 to 90. This is stage 1 hypertension. And then there is stage 2, where blood pressure is more than 140, the top reading, the bottom reading being more than 90. And there is something called as hypertensive emergency or crisis. So when blood pressure is more than 180 by 20, this is when we try and take immediate attention, get the patient admitted to the hospital, put them on a drip to reduce blood pressure. So that is very, very high blood pressure. So we do have different stages of hypertension, and all stages, whether it is pre-hypertension, stage 1 or stage 2, needs intervention and needs to be given equal importance. And you should see your healthcare professional and discuss with them about how to manage each of this. And I hope this answers the question.
Yes, doctor. And also, doctor, we know that there are many health complications which are caused due to hypertension. Can you kindly brief our audience for today on different types of complications which is mainly related to hypertension?
Yeah. Yes, I think hypertension is called the silent killer. Yeah. When I check a patient's blood pressure, they just get a bit puzzled as soon as they say, when I tell them that its blood pressure is 159, they say, doctor, I'm well. Is your machine working, or have you checked my blood pressure properly? Because blood pressure rarely causes symptoms. It causes complications too. So when blood pressure is high, which means the blood vessels where the blood is flowing through are stiff. And once the blood vessels are stiff, the blood circulation, the oxygen levels, the nutrients, which all parts of the body is reduced. And some of our vital organs like your brain, the heart, the kidneys needs blood flow continuously. And if you don't get enough blood flow, you end up having organ damage or your vital organ starts failing. So start with like heart. So the major problem with the heart is people get heart attacks. And currently in India and elsewhere in the world, hypertension is the leading cause for heart disease or heart attacks. And apart from this, even people without getting heart attack, the heart pump can get weaker. There's something called as heart failure. So once the heart pumps gets weaker, there's not enough blood flow going around. There's accumulation of water and blood. People start getting breathing problems. Their legs start swelling up. So again, a serious problem called as heart failure. If brain is affected, you get strokes. And there's something called as aneurysms. Your blood vessels starts getting bloated up, and they can burst open anytime, causing bleeding. So the hypertension can cause bleeding within the brain, leading to a stroke. Or sometimes there's the main blood vessel called the aorta, which is like the main tube which carries from the heart to our stomach and legs. This can sometimes get bloated, causing aortic aneurysm. And if this bursts open, it can even kill people. Apart from this, kidneys are another organs which normal blood pressure affects. Kidney failure, kidneys getting weaker, people needing dialysis. Hypertension is one of the most common causes. Apart from this, as people get older and as blood circulation to the brain is getting weaker, they can start forgetting things. And dementia is another common complication of hypertension. Eyes, you'd be surprised to know that eyes, blood vessels in the eyes are very fine, and they can only handle blood pressures to a certain extent. And if blood pressure is higher, they start burst open, blurring of vision, visual losses can happen. And also, especially smoke and have high blood pressures, gangrene, where there's not enough blood circulation in the feet, the legs go black and dark and very painful, where people need to have their foot amputated. So hypertension can cause serious health problems. So blood pressure needs to be checked, and if blood pressure is high, everyone needs to see a healthcare professional to have that blood pressure addressed.
Yes, doctor. Thank you. And also, doctor, according to World Health Organization, the number of adults with age group of 30 to 79 years, their hypertension issue has increased from 650 million to 1.28 billion in the last 30 years. And more than 700 million are living with untreated hypertension. Why is this hypertension issue more prevalent in recent days, and who are more susceptible to it actually?
It's certainly very scary numbers. And these are all true facts.
Yeah.
And if you look at Indian numbers too, about 1 in 4 of us between 30 to 80 have blood pressure. And only about a third of them know that they have blood pressure. People are walking around without knowing that they have blood pressure. So there are a huge number of people with diabetes. And why is it increasing? Hypertension is a lifestyle illness. Our lifestyle has changed. If I were to ask my grandfather, his lifestyle, he said, I would wake up 6 in the morning, go to the farm, dig, work hard, toil around, walk 10 kilometers back home, eat healthy meals, a good amount of vegetables that they grow, and have a good night rest. But there's rapid urbanization. If I were to take my own lifestyle, I now have very long working hours, very small amounts of rest, limited time for exercise, and my diet has also significantly changed. So hypertension is definitely a lifestyle illness. So our way of living because of urbanization has changed. Salt intake has significantly increased. The recommended salt intake for an individual is 4 grams or less. And an average Indian salt intake is between 8 to 10 grams per day, at least more than twice.
Yeah.
Not enough fiber in the diet. Fetching a McDonald's burger these days is easier. Or even if you go to any of our, if people are living in Bangalore, there is Darshini fashion where you get ready, everything is quick and ready. You can't see any single vegetable there. You get a big serving of rice bath, no vegetables at all. So lack of fiber in the diet, and I was saying no exercise at all. And all this leads to people putting on weight. And once you put on weight, you're at higher risk of getting high blood pressures.
Yeah.
Stress, you ask a child, you ask an adult, everyone is stressed these days. And we are not handling our stress well. We are not sleeping well. You need at least 6-7 hours of sleep, and people nowadays get 4 hours sleep, and you're watching IPL late in the night, and you have to wake up again early in the morning. I think these lifestyle changes is what has led to high blood pressures. Apart from the other things, smoking, alcohol intake, those individual habits. And other common thing that I see in practice is people are using painkillers excessively. You go to the drugstore, I get a headache, start popping them as candies. So excess painkillers can also be one of the reasons why people get high blood pressures. But overall, it's one's lifestyle which is causing very high blood pressures.
Oh, yes, doctor, that's true. Mainly the cause for high blood pressure is lifestyle that we all are following in recent days. That's true. And also, doctor, can you please explain our viewers how to monitor hypertension, and how accurate are these blood pressure values, which is diagnosed through digital monitors, which presently our patients are using?
Okay. So traditionally, blood pressure machine always used to be going up to the doctor or a nurse, having a cuff wound around your hand, and with a mercury meter, the nurse would or the doctor would measure it for you. But we are now in the digital world, and we have electronic gadgets which check blood pressure, including a watch which can check blood pressure. So there are different sort of devices, and I often ask this question by my patients. They get confused. The Apple Watch gives a blood pressure reading. Is it really an accurate blood pressure reading? To me, an ideal situation would be a person walking up to the doctor, having the blood pressure checked, but it's not practical actually. So how often do you get a time to go to the doctors or to the nurse to have your blood pressure checked? And a suitable alternative is using a digital monitor. The digital monitors have evolved. They are being calibrated to various extent. And the other thing is, when we use a digital monitor in the comfort of our home, we may get a much truer blood pressure. There's a condition called as white coat hypertension. As soon as a patient walks up to my clinic, their blood pressure goes up because they're anxious about how their BP is going to be. But if the same thing is done at their own home, in their own surroundings, with a digital monitor, the blood pressure is probably a much more truer representative. And apart from this, with a digital monitor, the practicality says you can check it multiple times a day. You can check in the morning, afternoon, whenever you're free. And also, you can check your blood pressure after you've rested for a while. When you go to a doctor's clinic, you've just walked in the clinic, you've not had enough rest, blood pressure is already checked. So, though a doctor's machine may be more accurate, digital monitors, I feel, are very, very accurate and also gives better information for an individual. So, if you really don't have one, I would recommend you should get a digital blood pressure monitor. I would recommend the one where you put the cuff around your arm rather than the one you put it around your wrist. And these are fairly easy to use. You could just search on YouTube, or I think our QurHealth may have one video of how to check your own blood pressure. But if you would check your blood pressure at home with a BP monitor, I would recommend first, sit down, get relaxed on a comfortable place, your back resting, be still for at least 15 minutes. Don't smoke for at least half an hour, 1 hour before. Avoid coffees or exercise at least 30 minutes before you measure. And also make sure that you have emptied your bladder. With a tight bladder, your blood pressure is never going to be normal. And once you're positioned well, put your hand on a comfortable flat place and tie the cuff around your arm with the tubing in the center. And the arm should be at the level of your heart. You can't lower the arm down, but at the level of your heart. And most of these digital monitors, you just have to press a button and be relaxed, and it gives you a reading. We usually recommend checking your blood pressure thrice. So you check your blood pressure, wait for 2 minutes, check it again, note it, and again, wait for 2 minutes and check it again. So then you can either take an average of 3 or take the lowest possible reading as your blood pressure.
Thank you. Thank you very much, Doctor, for the detailed explanation. You wanted to add something, Doctor?
The only last thing I wanted to add was take your clothes off. I mean, so you can't have a sweater on your arm and then check your blood pressure. You should take it off and then put it on the bare arm.
Yeah. Yes, Doctor, that's correct. Thank you. So now let us ask few questions to our expert, Dr. Sujatha. Dr. Sujatha, research states that about 2/3 of adults with diabetes have blood pressure. Because you are an expert diabetologist, please let our audience know if blood pressure is greater than 130/80 mm of Hg, why is this condition more prevalent among diabetics?
Thank you, Dr. Jamuna. To answer your question, actually, what is it is, usually hypertension is also presenting with, it is a metabolic syndrome, and also it is a there are many things playing into action, like your sympathoadrenal system and all those things. Basically, what happens in diabetes and hypertension together is there is something called as insulin resistance in diabetic patients. So with this insulin resistance, what happens, they are going to create what is called as arteriosclerosis. They cause thickening of the blood vessels. So because of this thickening of the blood vessels, what happens is usually such patients are more prone to get in diabetes, what happens, there is insulin resistance. So this is also causing arteriosclerosis, and this arteriosclerosis in turn is also leading to hypertension. So these both conditions are vice versa and directly proportional to each other. So here what happens is, that is why what happens is about 2/3 of patients with diabetes usually present with hypertension also.
Okay. Yes, doctor. And also many studies show that people with diabetes and high blood pressure, they are more at risk of having heart attack or stroke. Is this due to diabetes or is this due to high blood pressure?
Like already what I told, it is both equal. It is due to diabetes, the microvascular changes occur in diabetes. And also if you're taking a hypertension also, there is again arteriosclerosis taking place. Thickening of the blood vessels are there. So here what happens is, because of this thickening of the blood vessels, that in turn also increases the blood pressure. That is one of the reasons for stroke. There can be an atheromatous plaque, and this atheromatous plaque can become that is a thrombus, and this thrombus can be an emboli, and that can go and block the minute arteries. The microvascular changes can occur. This in turn, like both hypertension and diabetes, if the glycemic control is not there and if the blood pressure is not under control, both have a chance of, like, these both are the risk factors for a stroke or a heart attack. To thickening of the blood vessels itself and the increase in the blood pressure.
Okay, doctor. And like you already said, doctor, like hyperglycemia, we know that it causes hypertension and vice versa. And does hypoglycemia also cause hypertension issue in patients?
Yes, there are few studies where actually what happens is there is a few studies have done, and the studies state that hypoglycemia itself is a cause for hypertension. How is that? Because it is activating the sympathoadrenal system. Because of this activation of the sympathoadrenal system in hypoglycemia, what happens is that in turn causes hypertension. So hypoglycemia is a predisposing factor for hypertension because of the activation of the sympathoadrenal system. So that is the reason, like patients, though they are having hypoglycemia, they can present with hypertension. They will have increased blood pressure.
Okay. And what are your suggestions for a hypoglycemic patient? How they can prevent blood pressure, doctor?
That is, you can prevent blood pressure or prevent hypoglycemia.
Blood pressure, like how can they prevent? See, for example, we already know that they are hypoglycemic, and the fact is that they are going to be hypertensive. So how can they control their blood pressure?
For that, they should, like how Dr. Sudeep sir told, salt restricted diet, weight management, avoid eating unnecessary junk, and maintain the salt less than 4 grams. And especially diabetic patients, keep their sugars under control, adequate amount of fluids, and then they have to try to maintain the electrolytes also, because the electrolytes also play a major role in managing the blood pressure. One thing. And next thing is, if you're a diabetic, particularly see that you don't go in for a hypoglycemic attack. So as we know, hypoglycemia is also an aggravating factor for blood pressure. So you see to that you don't go in for hypoglycemia. So like small frequent meals, like you eat for 3 meals and 3 snacks. See to that you're spacing your diet, and then a regular walks, a 45 minutes of physical activity or a strength training. Keep some healthy snack often, so that what happens is you will not go in for hypoglycemia. And also your metabolism, all these things will boost your metabolism. So when all this is boosting your metabolism, and your glycemic control will be there. Avoid all refined foods like maida, white sugar. Don't take carbonated drinks. Basically you have to avoid getting into hypoglycemia, and also you have to avoid like to increase the blood pressure. So for this, you have to keep both your blood pressure also in ideal target, and also your sugars in the ideal target. So maybe if you're feeling that you are getting a hypoglycemic attack, you have a glucometer with you, immediately you can check your sugars. And if you feel you're getting sweating, palpitations and all those things, immediately, as you know, like 15 to 30 grams of simple sugars, something which will instantly release the insulin and glucose, food with a little more glycemic index, immediately you can take that. Then a diabetics and hypertensive, it is very good for them to do 3 weeks 3 times a week resistant training, so that what happens is your muscle gets building. In that ways, what happens, your glycogen, your muscle glycogen is also utilized, your fat cells are also burned, your metabolism is improved. So actually, and also you will maintain your ideal body weight. All these things can help in maintaining the sugars and the blood pressure under control. Likewise, we need not have to go in for hypoglycemia. Then all these precautionary measures will help us to maintain the things in a regular targeted levels.
Okay, thank you, doctor. And also some studies state that pregnancy-induced hypertension, this is one of the most common causes of both maternal and neonatal morbidity. This is affecting about 5 to 8% of pregnant women. Doctor, can you please explain about complications of high blood pressure during pregnancy?
Yeah, complications of high blood pressure in the pregnancy is actually, it is dangerous for both a mother and the child. Basically, when you see the mother's complications, if a mother can throw in a seizure, she can throw in a fits, she can develop a fits, which is called as eclampsia. She can go in for an eclamptic condition. Sometimes the mother's coagulation profile will be, when she's not having a proper controlled blood pressure, what happened when before that I would like to tell hypertension in pregnancy is a separate topic. What happens is a chronic hypertensive becoming pregnant, the complications are different. Then a pregnant lady after 20 weeks of gestation suddenly will develop hypertension. That is called as gestational hypertension. So both blood pressure increases in the pregnant women. Usually it will cause maternal complications, fetal complications. Now, what are the maternal complications? As I already told, the mother can throw in a fit. She can throw in a seizure. Okay, she can develop fits. That's one of the this. Sometimes there will be a dislodgement of a thrombus. It become an emboli. That itself can cause a stroke in the pregnant mother. Then it can also cause an acute kidney failure. It can cause a temporary kidney damage. And there is something called as a HELP syndrome, where it is going to also damage the liver of the mother. And also clotting factors, there will be excessive bleeding from the mother, like because the coagulation profile also deranges, that can cause clotting problems also. And another thing is there is an abruptio placenta in the sense, abnormally the placenta can get separated from the endometrium, that's from the uterus. So here what happens, there will be profuse bleeding which can lead to the shock to the mother. There are chances of the mother losing the life when there is uncontrolled hypertension. That is what you call in pregnancy induced hypertension. And another complication for the fetus can go in for hypoxia, a state of hypoxia. Then there are chances of even losing the child, because if the mother's condition itself is not good, their survival of the child's chances will be less. The blood supply to the child will be less. So in pregnancy, during hypertension during pregnancy, we can expect a small baby. And also it can cause kidney problems to the child also. Amniotic fluid can be less. So all these complications can occur if in pregnancy hypertension.
So as you clearly explained, doctor, the difference between gestational hypertension and preeclampsia condition, what are your suggestions for preventing and controlling this gestational hypertension and preeclampsia, especially in pregnant women?
Usually, if you ask me what do I want to do, or what you want, I would like to advise, first is water intake. Good water intake. Restrict the salt intake. Use salt very minimal. Especially, see, for chronic hypertensive patients who are becoming pregnant, they have to, right from the beginning, from the time they become pregnant, they have to restrict their salt. And also they have to take their medications regularly. They have to keep a check of their electrolytes. Also they have to keep checking their coagulation profile, their hemoglobin profile, all those things. They also have to check their liver enzymes in timely checkups when they are going for their timely checkup. And it is better they keep a blood pressure monitor with them, and they keep checking their blood pressure every now and then. Then very important is fluid intake. They have to take good amount of fluid. And if it is a summer season, they also have to keep a check of their hydration status, and also their electrolyte balance. They have to keep their electrolyte balance. And most important is they have to take a good rich protein diet, because in the hypertensive pregnancies, so they have to take a good proteinaceous diet. They have to keep the protein intake good, and they have to avoid all fried foods and junk foods, all that. And minimum of 8 hours rest. They have to ensure adequate rest, and at least prenatal exercises is a must. They have to follow a proper routine. They have to follow the routine, the prenatal exercises like prenatal yoga or some stretching exercises. All this will relax the mind. Also, it is going to release the endorphins and all. Once we exercise, the happy hormones are released. The studies are there that happy hormones release once we start exercising. So that is going to calm our mind. A simple yoga or a soothing music, all this is going to help a pregnant woman to manage her diabetes, or if even she's gestational diabetic, to also it will manage, it will help her to maintain it in a correct targeted levels. Next thing is like ambulation is very important. A pregnant woman should not keep sitting for a long time or lying down for a long time. Always she should ensure that she takes a small breaks, maybe a walk of 5 to 10 minutes between a long hours of sitting. Especially nowadays, we have working women's working from home. They are pregnant, they sit in a single room with their laptops in the room, they don't walk around. So it is a very important that they take small intervals of breaks and they walk. And also, if they are sitting or if they're in case traveling in long distance travels, they have to keep moving their limbs, the lower limbs, they have to keep moving. They have to keep squeezing their calf muscles, so that all this will prevent the deep vein thrombosis. And also it will help in controlling the symptom, that venous return to the heart is increased, thereby that is also going to maintain their blood pressure. So all this they have to keep in mind. Especially about the saturated fats, so they should avoid all fatty foods. That is very important, and oily fried foods. And if they're having vomiting and all, they have to try to keep their sugars, I mean they keep their electrolytes under control. And what I would like to tell is, any pregnant women after 20 years or 20 weeks of gestation, they should keep a check of warning signs. What are the warning signs? Severe headache, vomiting, severe vomiting suddenly, that is in the first trimester they didn't have vomiting, and after 20 weeks of gestation they start developing excessive vomiting, excessive tiredness, excessive thirst, epigastric pain. Especially women with epigastric pain, that after 25 months or 20 weeks of gestation, if the woman is having epigastric pain, those are all the signs of pregnancy induced hypertension. So this and all they have to keep in mind. Abnormal swelling of the foot, when I say swelling of the foot, usually in pregnancy there is a swelling of foot, but if it is swelling very abnormally, usually if you take pregnancy induced hypertension and normal swelling feet, what will happen is, the women, if she takes rest with the foot elevation, the swelling will come down. But in pregnancy induced hypertension, or if the BP is high in pregnancy, the swelling will not come down. So the women have to keep all these points in her mind when she is either hypertensive and becoming pregnant, or when she is developed pregnancy induced hypertension. Now this pregnancy induced hypertension will again lead to a condition which is called as eclampsia also, or a pre-eclampsia. So that's a total different entity. This is a total different entity. Basically, to control everything, lifestyle is very important. Like how our care plans are there to monitor, maybe they can enroll with our care plans. Our care plans are giving a detailed plan as to what they have to do, at what time they have reminders to take the meals, or they have reminders to check the BP, they have reminders to look for the food, they have reminders for drinking water. So I think definitely if they are using our platform, it is going to help them. So all that is just a lifestyle measure only, because all this hypertension and diabetes is all lifestyle correction. You correct that, everything falls in place with the minimal drugs requirement.
Thank you so much, Doctor, for the elaborate explanation that you gave. Let's move to Dr. Sudeep again. Dr. Sudeep, I want to discuss obesity-related issues. So obese people are more likely to have high blood pressure, and this is very common. And they also develop hypertension complications, which lead to issues like CVD or CKD. Can you please elaborate on obesity and its relationship with hypertension?
Yeah, certainly. Obese people are at higher risk of getting high blood pressures, and also there's increased heart disease and kidney disease. If you go back and think about how humans evolved, we were basically hunter-gatherers living in forests with food not easily accessible. People used to hunt and eat as and when they needed. And also, they used to gather fruits around in the forests, and they were probably eating a lot more fiber than we do now. So our lifestyle has changed, and because of this, people are gaining weight. And the change in an individual's weight has rapidly happened in the last few decades. And humans don't evolve so quickly. Our body can't handle the extra weight, extra fat that we carry around. And so all our organs are failing. So if an individual is overweight, the extra fat tends to make different kinds of hormones which interact with the kidneys and the heart. And all these leads to blood pressure going up. And once blood pressure goes up, heart disease, kidney disease, I've already alluded to, and Dr. Sujatha was saying that too. And apart from hypertension, if you're obese, your risk of diabetes goes up. And once you have diabetes and hypertension, then you have two bad brothers with you, and higher risk of heart disease and kidney disease.
Yeah. Doctor, nowadays, most of the studies are on DASH diet, that is dietary approaches to stop hypertension, which they claim that this diet is going to lower the blood pressure. So doctor, can you explain our audience, what is the significance of this DASH diet and how does it help in lowering the blood pressure?
The DASH diet is a proven, well-researched diet plan, which is mainly come from the America. And it's actually promoted by the American health agencies too. It's more or less a healthy, high fiber, low fat, low salt diet. So it mainly includes a good serving of fruits, vegetables, usually low fat dairy products or fatty dairy products. And they encourage eating whole grains, not white rice, but brown rice or unpolished rice or millets. So whole grains. You avoid red meat, but have fish or some chicken or some vegetable proteins like nuts and dals. So these, you change what is on your plate. So you're eating healthier options, and also you reduce salt intake and sugars and sweets. Maybe if I were to give you maybe a sample example diet plan, you would have, if you were to look at your plate, you will have a couple of servings of unpolished rice or millets. You will have a large portion of fruit in your diet. You will have a large portion of vegetables. So the fruit and vegetable will be half your plate. Then at 25% of your plate, you'll have low-fat dairies and a tiny serving of oils. And you can have fish or healthy vegetable proteins in your plate. So this, you change the balance of your plate and use low salt. So everything has less salt. You use less than 4 grams. So it's about 2.4 grams of salt is used per day for cooking. And with this DASH diet, you can also enjoy other foods, but you limit it. So if you're having desserts and sweets, you would limit to maximum of 4 to 5 small servings per week. So you can enjoy all kinds of foods, but you would have more of the healthier options and less of the junks or the unhealthier options. And with this, there is research proven evidence, and we probably see this in our clinical practice too, that an individual feels healthier, loses weight, their blood pressure improves. And this is, mind you, without any medications.
Okay, doctor. And I have one more interesting question, doctor. It is mentioned that systolic blood pressure is more related to increased risk of cardiovascular disease. Especially during exercise, it is mentioned that systolic blood pressure increases with intensity. And why do you think is only systolic blood pressure related to CVD?
So I think a good question. So especially here, I have the questions are systolic blood pressure and the heart disease. This is a well-proven thing. The top reading, especially when the heart pumps. If the heart has to pump against a higher blood pressure, then the heart is doing more work. That would mean higher risk of heart disease. I could put that in a common man's terms. But at the same time, the diastolic blood pressure or the blood pressure when the heart is relaxing is also important. Both are related to cardiovascular disease, and I feel both are equally related. And you would want both your systolic and diastolic blood pressure under control. But there are quite a few number of my patients who have isolated systolic blood pressure. So they only have high systolic blood pressure, their diastolic blood pressure is normal. You would not ignore these individuals. These individuals are also at a very high risk of heart disease, especially this is the elderly population. Those who are more than 70 tend to have a high systolic blood pressure, and we should give it the equal importance, advise them lifestyle changes, and also give them medications to control the blood pressure. And exercise particularly, when you're exercising, your heart pumps faster, has lesser time to relax because it's beating fast. So the systolic blood pressure does go up with exercise. So if your blood pressure is already high before exercise and you push it higher, people could end up having heart disease while exercising. So whenever people want to join a gym or take up exercise, it might be useful, especially the ones who are more than 40, to have their blood pressure checked before they take up, especially intense exercise. I won't discourage people from taking up exercise, but they should have their blood pressure at least checked once before they take up any regular exercises.
Okay, doctor. Some studies also say that 54% of the stroke and 47% of coronary heart disease, these are linked to high blood pressure. And also young adults between age of 18 to 45 years, they are at high risk of cardiovascular disease rather than older adults. As Dr. Sujatha already mentioned, that all this is mainly because of the lifestyle that we are leading. And especially in the, you also mentioned, doctor, because of urbanization, we see the changes in health condition of the younger generation. So in most of the times, people who go to work say that I have been exercising regularly. I'm taking care of my health, eating proper food, I sleep on time. But I don't know how I developed heart issues. I don't know how I developed hypertension. So, doctor, what do you suggest to these working population, especially people in the corporate sector, urban areas? How should they be alarmed about their heart condition?
So hypertension, heart disease is definitely lifestyle related. And urbanization, long working hours, stress are playing a huge role in an individual's health. So apart from exercising regularly, eating healthy, getting adequate amount of sleep, I think how an individual manages stress also plays a very important part. So people can take regular breaks from work. We could spend time with family, which no one does these days, which are usually good stress busters, listening to music, going out for a meal, forgetting about work, switching off mobile phones and limiting screen time. I think all these would make an individual happier, less stressed, and this definitely would lead to reduced heart disease as well. And these are 18 to 45-year-olds are the ones who are going through this corporate.
Yeah.
Yeah, I think that working age group are generally mainly the 18 to 45 or 50 years, where they're really toiling hard.
What are the early symptoms, doctor? Like how can a person get alarmed that, okay, there's something wrong with my heart, or something is varying with my blood pressure? So what are your tips to keep a check on these things?
So hypertension especially is a completely silent disease. People don't get symptoms until they get complication. Already, if they were to get chest pain or if they're getting leg swelling because of kidney problems, already too late. So my tips are, get your blood pressure checked. At least once every 6 months. It doesn't take much time. It takes hardly a few minutes to have your blood pressure checked. Every few months, having a blood pressure check would detect more hypertension, and it will give an individual at least time to think about how we would manage his lifestyle, and also see a doctor and start medications if that was necessary.
Thank you, doctor. So I have a few more questions to Dr. Sujatha. Doctor, there is one interesting study which states that renal hypertension is less dangerous than portal hypertension. And in portal hypertension, the constriction is too strong that it causes kidney cirrhosis. How can portal hypertension be prevented?
Actually, portal hypertension is like in the body, we have something called as a portocaval anastomosis. So here what happens is the systemic veins anastomose with the caval veins. So this is usually a potential anastomosis. It's a physiological anastomosis. There is no, it's just an anatomical anastomosis, and there is no exchange of blood taking place there. So in cases when there is a portal hypertension, what happens is these radicals, portal radicals open up, and there is exchange of blood there. So here what happens is people with portal hypertension can present with a variceal bleed, is either a blood vomiting, or they can present with bleeding per rectum, or they can present with abdominal distension. All these conditions can happen with portal hypertension. So actually portal hypertension is a different entity, and renal hypertension is a different entity. So in portal hypertension the presentation is different, in renal hypertension the presentation is different. Portal hypertension, again, it is primary and secondary. Portal hypertension can come secondary to liver cirrhosis or alcoholic liver disease, and renal hypertension is secondary to the systemic hypertension. So so these are the differences between portal and renal hypertension. So when you ask me which is dangerous, both are equally dangerous only. So it is not that portal hypertension means it is not dangerous and this renal hypertension is only dangerous. Not like that. See, like if you ask me what is important for your body, whether you need food or you need this, or you tell if in two eyes, if one eye is not okay, like that, something like that. So for normal functioning of our body, liver is also important, kidney is also important. We should keep both under control. So basically, if you ask me, how do we prevent portal hypertension, or again, how do we prevent hypertension for that matter, as we've been discussing since so long? First thing is for portal hypertension, again, salt restriction plays a major role. Alcohol plays a major role. Quit smoking plays a major role. Then also all these, like you have to cut on the smoking, quit smoking, all those are the measures to prevent portal hypertension. So basically we have to think about, if you are thinking about portal hypertension, all these is very, very important. So we have to quit smoking, we have to quit then what to say, quit smoking, quit alcohol, follow a healthy lifestyle, and then we have to also eat right, like whatever you told, that DASH diet and all those things. So in portal hypertension, all these matters. So both the hypertension is equally important, and both should be prevented, that too with lifestyle measures.
Okay. And if we discuss about elderly patients, there is a demarcation for old and very old population in the management of hypertension. which we can call as geriatric patients. So, doctor, how exactly does hypertension management differ in old and very old patient population?
See, in very old patient population, many things come into picture. Like, say, suppose I don't want to control the hypertension too low. See, for me, old patient, very, very old patient, a fragile patient, if it is around 50 to 60 years or some 60 years like that, I would like to maintain their blood pressure in the range of 140 or like 140, 150, like that only either. But when I take a very, very old patient, no, I would not want to bring it too low. For me, what I think of a old patient, rather than maintaining is BP alone, I am concerned with other things of his aspect, life's aspect, that I don't want him to come for a hypotension such that his BP becomes too low. So for the old patient, along with medications, it is very, very important to educate them about the symptoms of a hypotension, because I would not want to fall in a old patient and the old patient go for a fracture or something like that. So we need not the targets for an older patient are much relaxed when compared to targets for a younger patient and a little older patient. For frail older patients, the targets can still be relaxed, and we need to not be very strict. But for them, what is more important is the psychological support, caretaker support, education to them, and dietary management. And we have to tell them about the warning signs and the red flag signs, and of course medication, not to too much decrease the BP, but to keep them in a little higher target is what we need to aim at.
Thank you, doctor. Dr. Sudeep, I have one last question to you. So hypertension is also known to cause damages to the blood vessels in the eye, which will further lead to retinopathy complications. So in patients with diabetes and hypertension, these eye complications are very severe. What is your take on this?
Diabetes and hypertension are nowadays becoming the most common cause of blindness, even in a developing country like India, much more than cataracts and eye infections. So the eye has a very fine, slim layer of blood vessels, and when blood pressure goes up, these blood vessels starts leaking blood out, and once blood starts leaking out, it blocks the nerves and people can't see well. This problem usually happens when individual blood pressure and diabetes has not been controlled for several years. And this is entirely preventable. So if an individual can check his blood pressure regularly, look after his lifestyle, have his blood pressure, diabetes in check, it can completely be prevented. So anyone who has high blood pressure, who has diabetes, they should also see an eye doctor to have their eyes assessed at least once a year. And this is a simple, basic eye check. Usually the individual will have drops put into their eyes, and the eye doctor looks inside the eyes with whatever machines they have. And it's certainly very, very important for an individual to go for these tests.
Thank you, doctor. Now let us move to audience questions. Dr. Isha, if audience have any questions, can you please ask?
Thank you, Dr. Jamuna. Thanks, Dr. Sudeep and Dr. Sujatha. And we do have few questions. One question that the audience has asked is, we are nowadays seeing a lot of, information about sodium-based salt. Potassium-based salt instead of sodium-based salt. So exactly what is the fact around it, and how does that help in maintaining hypertension? If Dr. Sudeep, if you can answer that.
So usually most salts either would have sodium or potassium. Sodium chloride, our regular salt is plain sodium chloride, but some of these what called Himalayan salts or the other potassium-based low sodium salts has lower sodium, but has other salts such as magnesium and potassium in it. The mainly reduction in reduction in sodium has a health benefit. So people should consider any salt which has low sodium. I think that's the most key important message that I would want to pass on. Sometimes some of these salts may say they have slightly low sodium, but if you use a bit more than, if say a teaspoon supposed to have 3 grams, if you were using 2 teaspoons of a low sodium salt, you're still getting more sodium than an individual needs. So you should still watch out for the total amount of salt you take.
Okay. Thanks, doctor. One of the audience is asking a question that he has been a hypertensive patient, but lately, and he is on medication regularly, but lately during the evening time, he feels very weak and starts collapsing. So is there something that he can do for that?
I think it's he probably needs to definitely see a doctor and have it assessed. Sometimes individuals could have something called as orthostatic or postural hypotension. So as soon as an individual gets up, their blood pressure stops really low. So that has to be assessed. Until he sees a doctor, he can ensure that he drinks plenty of fluids. Be careful when he especially stands up from a sitting position. So if an individual can take time to rest and take time to stand up, maybe the GD spells could be limited. But anyway, if he's been falling frequently, you should see a doctor to have an assessment.
Sure, I too agree to that. And there's one more question, Dr. Sujatha. I think so you will be a better person to answer that. One of the audience is asking that his wife got high BP, and after that COVID in September, and she has been taking her medications regularly. However, even with medication, while measured in the morning, her BP comes like 154/80, that is higher range. And further, there is a gap in her systole of more than 40. So is there something that can be done?
Yeah, definitely, because monitoring is required, and if this is maybe the drugs has to be amplified, and also we have to look into what is her lifestyle, like what kind of sleeping habit she's having, activity, what is her lifestyle modifications, like, and stress levels should be assessed. And there is, like in BP also, no, there is something called as diurnal variation. At particular time of the day it will be varying, also depends on many other factors. So she needs to definitely keep a check of it, and for a week or two she could monitor it, and if that is the same thing with her, then I think she definitely needs to visit her doctor or a treating physician. And maybe the drugs whatever she's taking, there could be a change in the drug, or there could be an amplification in the dosages. I think that should be done.
Sure. Thank you, Dr. Sujatha. Last question. I just got one question. I know we are above the time, but there's one more question. If a person has high BP but does not know about this, will there be any problem? And if he or she does an intense workout?
Yeah, could be, because what happens is high BP intense workout, again we very well know that when we are doing workout, our blood pressure also increases, and also the heart rate also increases. That could also amplify. So then what happens is they might experience some symptoms, like some discomfort, or they get excessive palpitation, or they may not be able to do that intense workout and all those things. But still, yes, if they're experiencing any discomfort or some discomfort symptoms, better is they need to check it properly.
Sure. Thanks, Dr. Sujatha, for the valuable information. I think so, Dr. Jamuna, we are done with the questions from our audience.
Okay, thank you, Dr. Isha. So, dear viewers, I would like to thank Dr. Sujatha and Dr. Sudeep for their valuable suggestions about hypertension-related complications. I am sure today all of you would have gained good guidance on controlling blood pressure and hypertension issues, which will in turn prevent various health complications. So please keep check on your blood pressure regularly and monitor it, and make sure that it doesn't lead to further complications. And also, dear viewers, to avail the benefits of our care plans and diet plans, along with the care coordination services, please download our QurBook app from Play Store. It is freely available. We will be very happy to serve you and your healthcare needs. Kindly contact us for subscriptions and further queries. Thank you all for joining today's session. Take care. Bye-bye.
Thank you.
Thank you, everyone.